What are the symptoms of asthma and who should be treated? 1. About asthma. Asthma is a common chronic condition that causes coughing, wheezing, chest tightness, and shortness of breath. The severity of these symptoms varies between individuals. Most people's asthma can be well controlled most of the time, though some people may have more persistent issues. Asthma symptoms can sometimes worsen gradually or suddenly. This is referred to as an asthma attack, though doctors may also use the term exacerbation. Severe attacks may necessitate hospitalization and can be fatal, though this is uncommon. 2. What exactly causes asthma? Asthma is caused by inflammation of the bronchi, which are small tubes that carry air into and out of the lungs. When you have asthma, your bronchi become inflamed and more sensitive than usual. When you come into contact with something that irritates your lungs, known as a trigger, your airways narrow, the muscles around them tighten, and the production of sticky mucus increases, phlegm. The following are common asthma triggers: dust mites in the home, fur from animals, pollen, tobacco smoke, exercise, infections caused by viruses. Asthma can also be triggered by substances inhaled at work, allergens or chemicals. Speak with your doctor if you believe your symptoms are worse at work and improve when you go on vacation. The exact cause of asthma in some people is unknown, but it is known that if you have a family history of the condition, you are more likely to develop it. Asthma can strike at any age, including children and the elderly. 3. Asthma symptoms. Asthma symptoms can range from mild to severe. Most people will only have occasional symptoms, but a few will have problems all of the time. Asthma's main symptoms are wheezing, a whistling sound when you breathe, breathing difficulty, coughing can cause a tight chest that feels like a band is tightening around it. These symptoms are frequently worse at night and in the early morning, especially if the condition is not well controlled. They may also develop or worsen in response to a specific trigger, such as exercise or allergen exposure. 4. Asthma attacks. An asthma attack or acute asthma exacerbation occurs when asthma symptoms worsen significantly. Although some people with asthma are prone to sudden, unexpected severe attacks, asthma attacks often develop slowly, sometimes taking a couple of days or more to become serious. It is critical to detect attacks early and respond appropriately. During an asthma attack, the symptoms described above may worsen, and if you're already taking medication, your inhaler may not work as well as it should. You may be monitoring your asthma with a peak flow meter, and you may notice a decrease in your peak expiratory flow. The following are symptoms of a severe asthma attack. A. Your reliever inhaler, usually blue, isn't working as well as it used to, if at all. B. Wheezing, coughing, and chest tightness have become severe and persistent. C. Being unable to eat, speak, or sleep due to a lack of oxygen. D. Faster breathing. E. A quick heartbeat. F. Drowsiness, exhaustion, or dizziness. G. Turning your lips or fingers blue, cyanosis. If you or someone else is experiencing symptoms of a severe asthma attack, dial 999 for immediate assistance. 5. Asthma causes. It is unclear what causes asthma, but it is most likely a combination of factors. Some of these may be inherited. A variety of environmental factors, however, are thought to play a role in the development of asthma. Air pollution, chlorine in swimming pools, and modern hygiene standards, known as the hygiene hypothesis, are examples of these. There is currently insufficient evidence to say whether any of these can cause asthma, though a variety of environmental irritants such as dust, cold air, and smoke can aggravate it. 6. Who is in danger? Although the cause of asthma is unknown, a number of factors have been identified that can increase your chances of developing the condition. These are some examples. A family history of asthma or other allergic conditions, referred to as atopic conditions, such as eczema, food allergies, or hay fever. B. Having another atopic disorder. C. As a child, I had bronchiolitis, a common childhood lung infection. D. Tobacco smoke exposure during childhood, especially if your mother smoked while pregnant. E. Being born prematurely, particularly if you required a ventilator to help you breathe after birth. F. Having a low birth weight as a result of womb growth restriction. 7. Occupational asthma. Asthma is sometimes linked to substances you may be exposed to at work. This is referred to as occupational asthma. Some of the most frequently reported causes of occupational asthma include isocyanates, grain dust and flour, colophony, latex, animals, wood dust. If you are regularly exposed to substances like these at work, you may be at a higher risk of developing occupational asthma. Paint sprayers, bakers and pastry chefs, nurses, chemical workers, animal handlers, welders, food processing workers, and timber workers are among the occupations most commonly associated with the condition. 8. Diagnosing asthma. If you have typical asthma symptoms, your doctor will most likely be able to diagnose you. They will want to know when and how frequently the symptoms occur, as well as if you have noticed anything that may be causing them. Your doctor may also inquire if you have any allergic, atopic, conditions, such as eczema or hay fever, which frequently coexist with asthma. A variety of tests can be performed to confirm the diagnosis. A number of tests can be carried out to confirm the diagnosis. These are described below. A. Spirometry. Spirometry, a breathing test, is frequently performed to evaluate how well your lungs function. This involves using a mouthpiece attached to a device known as a spirometer to inhale deeply and exhale as quickly as you can. The forced expiratory volume in 1 second, or FEV1, and the total amount of air you can exhale in 1 second are the two measurements made by the spirometer, the forced vital capacity or FVC. To get an accurate reading, you might be asked to breathe several times into the spirometer. The results are compared to typical values for people your age, sex, and height to determine whether your airways are congested. Sometimes after taking a preliminary set of measurements, your airways are opened up with a medication called a reliever inhaler to see if this improves your breathing when a subsequent reading is taken. Reversibility testing can help distinguish between asthma and other lung diseases, such as chronic obstructive pulmonary disease, COPD. B. Peak expiratory flow test. How quickly you can exhale air from your lungs in one breath can be measured using a small handheld instrument called a peak flow meter. The test is typically referred to as a peak flow test, and this is your peak expiratory flow, PEF. Your doctor or nurse will demonstrate how to perform this test and may advise you to take the best reading out of 2 or 3 because it takes some practice to get it right. You might be given a peak flow meter to take home and a diary to keep track of your peak flow measurements over the course of several weeks. Because asthma is unpredictable, your lung function could fluctuate throughout the day. You could also write down your symptoms in your diary. By using this, you can identify when your asthma is getting worse and decide what to do as a result of your diagnosis of asthma. Your doctor may ask you to measure your peak expiratory flow both at work and when you are not at work in order to diagnose occupational asthma, which is asthma that may be related to your line of work. The specialist may then be consulted to confirm the diagnosis by your general practitioner. 9. Other tests. Some people might also require several additional, more specialized tests. The tests could support an asthma diagnosis or point to another condition that needs to be identified. This will make treatment planning easier for both you and your doctor. A. Airways responsiveness. When the diagnosis of asthma cannot be determined by the earlier, simpler tests mentioned, this test may be used. It gauges the response of your airways to an external stimulus. If you have asthma, you will be asked to inhale a medication that purposefully narrows or irritates your airways, causing a slight decline in your FEV1 measured with spirometry and possibly inducing mild asthma symptoms. Your airways won't react to this stimulus if you don't have asthma. The procedure frequently entails inhaling progressively larger doses of the drug at regular intervals while monitoring the FEV1 with spirometry to see if it drops below a predetermined threshold. Exercise may, however, occasionally be used as a trigger. B. Airway inflammation. Testing to see if your airways are inflamed may also be helpful in some circumstances. There are 2 main methods for doing this. A sample of mucus, phlegm, may be taken by the doctor to check for indications of airway inflammation. Nitric oxide concentration, a special device measures the amount of nitric oxide in your breath as you exhale. A high level of nitric oxide may indicate airway inflammation. C. Allergy tests. To determine whether your asthma is triggered by particular allergies, such as dust mites, pollen, or foods, skin testing or blood test can be used. Additionally, tests can be performed to determine whether you are allergic to or sensitive to particular substances known to trigger occupational asthma. 10. Treating asthma. A. Reliever inhalers. Asthma symptoms can be quickly alleviated by using reliever inhalers, which are typically blue. Short-acting beta-2 agonists, which are typically found in inhalers, relieve the muscles that surround constricted airways. This enables the airways to widen, which facilitates breathing once more. Reliever inhalers are only meant to relieve symptoms. They do not treat asthma on a long-term basis because they do not lessen airway inflammation. Salbutamol and terbutaline are a couple of examples of pain reliever medications. Unless misused excessively, they are typically safe medications with few side effects. However, if asthma is well controlled, they should only rarely, if ever, be required, and anyone who requires them 3 or more times per week should have their treatment reviewed. A reliever inhaler, also referred to as a reliever, should be made available to everyone with asthma. B. Preventer inhalers. The use of preventer inhalers, which are typically brown, red, or orange, helps to lessen the sensitivity and inflammation of the airways over time, as well as the likelihood of asthma attacks. To keep asthma under control, they must be taken frequently, typically twice daily, occasionally once. Before you receive the full benefits, you must use the preventer inhaler consistently for a while. The blue reliever inhaler may still be necessary from time to time to help you manage your symptoms, but if this is the case, you should have your treatment plan reviewed. An inhaled corticosteroid is a common medication found in preventer inhalers. Beclometazone, budesonide, fluticasone, cyclazonide, and mometasone are a few examples of preventer medications. If you experience asthma symptoms more frequently than on occasion, and most definitely if you need to use a reliever inhaler more than twice per week, preventer treatment should be taken on a regular basis. Make sure to thoroughly rinse your mouth out after inhaling a dose of inhaled corticosteroids, because some of them may occasionally cause a mild fungal infection, oral thrush, in the mouth and throat. Additionally, lowering this risk is the use of a spacer device. Preventer inhalers may not work as well if you smoke.